Neonatal abstinence syndrome is a disease that babies develop when they have been exposed to often opiates in utero. Opiates are the most common cause of neonatal abstinence syndrome, but we know that babies can develop the syndrome when they've been exposed to other in utero drugs as well. But oftentimes, for example, with exposure in utero to opiates, babies after they're born, they suddenly aren't being exposed to the opiates and they develop what we call withdrawal symptoms. And those symptoms can be tremors, they can be irritability, they can be inconsolable at times, they can cry with a high-pitched cry, they can have gastrointestinal symptoms such as diarrhea. We know they can be significantly ill with seizures, but for the most part it is a lot of symptoms that are associated with a hyperactive neurologic system, including hyperactivity, hypertone, irritability. Once a baby's been exposed in utero, then the most important thing is that we monitor the baby to see if they are having evidence of withdrawal. Once they develop symptoms of withdrawal, we need to do a few things. We're getting better and better at treating them without medications. So we do initially use non-pharmacologic approaches. We try to keep mom there and present as much as possible, cuddling her baby, swaddling the baby, limiting the exposure, limiting the light exposure, limiting the noise exposure. We know that less stimulation is better for these babies. And oftentimes we can be successful with those things. If not, then we need to use an opiate. So we need to treat the babies with medication, and we use an opiate such as methadone or morphine. We start them on that medication and then we just very gradually wean them off that medication. When I looked at the numbers for Nationwide Children's Hospital, we had about 350 babies in 1 year time in 2014 that were treated for neonatal abstinence syndrome. But that doesn't capture the babies that don't necessarily need medication for treatment. So there are a lot more babies that are exposed to in utero drugs. A smaller number of those babies need treatment. We have really shifted our way of thinking in how to care for these babies. A few years ago, there was a lot of anger towards the mothers when we were taking care of a baby with neonatal abstinence syndrome, because we were watching a baby who was having a lot of symptoms and a lot of problems related to something that a mother did during pregnancy. Now we have used a much different approach, and we've been much more successful. We go to clinics for moms who are, to OB clinics, for moms who have used drugs but are on a maintenance therapy program, and we talk to the moms and we try to use a much more judgmental, non-judgmental approach so that we can encourage the moms to be there to get the care they need during their pregnancy, and then to be there after delivery to take care of their baby. We know one of the most important things that a mom can do to help her baby with neonatal abstinence syndrome is to be present, to visit frequently, to cuddle her baby, to breastfeed her baby, and then to remain on her maintenance therapy. So we've used a much different approach. We've really taught our staff to be less judgmental and to really try to understand where the moms are coming from so that the moms do feel welcome in the intensive care unit. We also know that we want to get the moms help after they go home. So it's one thing to treat the babies in the hospital, but we need to give the moms support when they go home and the babies support when they go home. And so we need to make sure that they have those resources so that mom can stay on her maintenance therapy, she can stay off of street drugs, and so that we can make sure that the baby gets the care he or she needs.